So as Masa said, I'll be presenting on human-animal tuberculosis transmission. As a note, I'm specifically talking about human-animal, not just zoonotic tuberculosis. Sometimes in the literature, zoonotic tuberculosis refers specifically to Mycobacterium bovis. So I'm talking about more species than that, and I'm talking about bidirectional transmission, not just human to animal. As a quick disclaimer, I am not a veterinarian, I'm not a physician, my training is in epidemiology. I have been working as a major project on assessing the molecular epidemiology of M. bovis in Washington State as part of my fellowship. So I've spent a long time in this literature on human-animal TB transmission, so that's where I've gotten the information for this presentation. As a conflict of interest statement, neither I nor my partner have had financial or other relationships with any commercial interest organizations within the past 12 months that may have a direct bearing on this CME activity. At the end of this, I'd like for participants to be able to describe species in which human-animal tuberculosis transmission has been observed and how this may inform clinical decision-making in certain settings, as well as describe controls to prevent human-animal transmission of TB to stem the spread of TB. So I'll start with a brief overview of MTB complex, then some human-animal transmission routes, and then go through some host species and human-animal transmission. So we're all on the same page. Mycobacteria has 3 clinical categories: Mycobacterium tuberculosis complex, or MTBC, non-tuberculous mycobacteria, or NTM, and M. leprae, causative leprosy. I am focusing on Mycobacterium tuberculosis complex today, which has quite a few species in it. M. tuberculosis, we see a lot, M. africanum, M. bovis, which is mostly seen in a host reservoir of cattle, M. caprae from goats, M. microti, M. cannidii, M. pinnipedii, M. mungi, M. aurigus, and M. suricatae, with the parentheses indicating species that are up for debate whether they get to be their own individual species. Transmission occurs through 3 routes: foodborne, which includes consumption of milk or meat from an animal with TB or food leftovers from a human or animal with TB. Respiratory, or inhalation of infectious droplets from humans or animals, and cutaneous, which you generally see with wounds, so like with hunters. Before I dive into all of these examples, I have a couple of caveats. One is that methods really vary in quality for assessing transmission. People have been looking at human-animal TB transmission for a long time, and that's before we had a lot of technologies that we could compare isolates with. So a lot of this has epidemiologic evidence alone, so person, place, time linkage, without an alternative explanation. They might say that a species transmitted to another species. There are also a lot of case studies including genotyping, so looking at a section of the genome in addition to epidemiologic evidence. And then finally, there are a couple of cases where they've used whole genome sequencing, looking at the entire genome and assessing just a couple of mutations to indicate transmission. And with that, you could even potentially assess direction of transmission. This is really rarely done, at least in the literature. I've seen 1 or 2 case studies of this being done for human-animal TB transmission. Another caveat is that this information is largely based on case studies. Data for animal tuberculosis prevalence or incidence rates is really limited. It's often not available. So a lot of this is just a bit of a random walk through the literature. I'll start with companion animals, specifically dogs. Dogs can be infected with M. tuberculosis and M. bovis, with most often we would see M. tuberculosis if they were infected. Some dogs develop clinical signs while some don't. They can get pulmonary TB, disseminated TB, abdominal TB, etc. They shed the bacilli by coughing and in saliva, feces, and urine. And there are a couple of diagnostic challenges. One is that they may not show clinical signs, which is difficult. And 2, they don't have reliable reactions to tests. They do not have reliable reactions to the acid-fast bacilli test or to the tuberculin test. They're often false negatives. Human to dog transmission has been documented at the genotypic level of evidence. Dog to human transmission is frequently listed as possible within the literature. So everyone says it's possible. I haven't seen any case studies. I couldn't find any case studies of this being shown to happen, but it is a public health risk that is taken pretty seriously. This is seen with the pets of tuberculosis patients, and this involves very close contact. So the pet is sitting in the person's lap, licking their face, eating their leftover food. One of the cases, the dog was licking up the coughed up phlegm off the floor. Yes, so graphic. Like I said, studies are rare. There was a study in the 1960s looking at TB sanatorium patients, and 14.5% of cats and dogs that were pets of the TB patients were culture positive for M. tuberculosis. So that's a pretty high amount. But they have, obviously a massive exposure going on with a sanatorium as opposed to in a normal household setting. So bacilli can be present in the pharynx and feces of dogs living in the same house with TB patients, even when the animal shows no TB lesions. So again, that's just concerning for whether or not there's a public health risk and knowing whether a dog has tuberculosis. And dogs can also be infected by other animals. This has been seen experimentally with other dogs. And then M. bovis from cattle and M. bovis from badgers. Badgers are actually a wildlife host reservoir in the United Kingdom. So they would bite dogs and they would get tuberculosis. As far as treatment and control go, in the literature, dogs are generally euthanized when they have tuberculosis. In addition, the Pan American Health Organization within WHO recommends euthanasia of apparently healthy dogs living with a TB patient. That is the only place I have seen that recommendation for actually euthanizing healthy dogs, but I do see widespread in the literature the practice of euthanizing a dog if it actually has TB. Because of the public health risk and because of a lack of treatment protocols. I think that if nothing else, it really raises the importance of how seriously this can be taken from a risk assessment perspective and really needing to think about minimizing close contact. We don't have, Department of Health, we don't have recommendations for this. We don't have guidelines specifically. So it's something that you would want to work through, but I think it's something to consider based on the literature. I did find one case study of a dog with intra-abdominal MTB infection being successfully treated in Germany, so random places. This dog was treated with antibiotics. The dog had serial fecal examinations for acid-fast bacilli, serial physical exams, and diagnostic imaging to make sure the TB was not progressing towards the pulmonary system. And these were exams that were like every month for a very long time to make sure that it wasn't progressing, because the authors acknowledged that if the dog had had pulmonary TB, it would have been a public health risk and needed to be euthanized. The dog was also isolated from immunosuppressed persons, young people, and elderly people, and reported to the public health authorities and clinically healthy at 31 months post-diagnosis when the report was written. Moving on to cats. Cats are mostly infected by M. bovis, but they can be infected with M. microti or M. tuberculosis. They can develop clinical illness, including pulmonary involvement. As with dogs, the tuberculin test is unreliable in cats. There's been documented transmission to other cats, to cattle, and most recently in 2014 in the United Kingdom to humans. Again, this is rare though. This isn't thought to be a common thing that occurs. Treatment has been seen to be, I saw that it was mostly euthanasia for cats with M. bovis. Treatment protocols are not available. I did find one case study in Texas of treatment with antibiotics and isolation to a room in a household. I did not see in this case study the duration of antibiotic treatment or the duration of isolation. So that was a bit unclear from the case report, but that has been done, and it's in the IED article, Emerging Infectious Diseases article. As far as birds go, birds can be infected with M. tuberculosis, like parrots. They've seen a case in a canary as well. I should probably note that obviously Mycobacterium avium is a much bigger concern for birds, but I'm just not really focusing on that in this presentation. Transmission has been seen from humans to birds via close contact. For instance, people will pre-chew their food and then feed their birds. It's been seen several times to be how the TB is suspected to be transmitted to the birds. As with dogs and cats, AFB is not reliable. They did have clinical signs apparent in these birds, like sublingual nodules and skin lesions. According to the Merck Veterinary Manual, human infection has not been associated with exposure to birds, but precautions are recommended, especially for immunocompromised people. So switching gears a little bit now to livestock, M. bovis is the primary concern for cattle. They are a reservoir host for M. bovis. They'll either be asymptomatic, and it takes a really long time for them to develop clinical signs. When they do, it's often pulmonary tuberculosis. Transmission has been seen cattle to cattle, primarily through a respiratory route, although foodborne does occur, like through calves. Cattle can infect other cattle, swine, goats, sheep, dogs, cats, and humans. And humans with pulmonary or urogenital TB from M. bovis can transmit it back to cattle. In the literature, humans can also transmit M. tuberculosis to cattle. However, there's some disagreement about how pathogenic it is for cattle. So most of the literature says it's not really, like it'll cause a skin test conversion, and cattle do get the skin test. but that it doesn't actually result in disease. However, I did find, of course, one study in China where there was equal pathogenicity for M. bovis and M. tuberculosis in cattle. So, yeah, up in the air. It would be a concern if a human had M. tuberculosis and was working with cattle. M. bovis in cattle is very rare in the United States. There's a national tuberculosis eradication program that's been going on since 1918. We have massive herd testing and culling or depopulation. If a herd has any cattle that are positive through both the skin test and then through necropsy. There's also massive pasteurization of our milk and our milk products, and then slaughterhouse surveillance. So that's cattle. Goats. So human to goat transmission has been documented. Goat to human, I have to think about that. Anyhow, there has been interspecies transmission between goats and humans. And it's also a concern for farmed deer. Farmed deer have been found to be a host for M. bovis. And in addition, actually, some wildlife deer, like white-tailed deer in Michigan, are wildlife hosts for M. bovis. So that's a concern, say, for a hunter, as that part of that population. Swine, sheep, and horses can be infected with tuberculosis, but it's thought that transmission to humans would be unlikely. And then zoo animals. MTB transmission can occur between humans and elephants, both directions. This happens from close, prolonged contact. This isn't casual, incidental contact where someone's just riding an elephant or going to the zoo or, and seeing the animal quickly. It takes a longer time than that as far as they've seen. Elephant treatment is recommended along with improving hygiene and sanitation in the barn. Isolation is sometimes used, and euthanasia is not recommended. In addition, M. pinnipedia transmission has occurred between sea lions and seals to humans. So for these animal keepers of sea lions, they saw skin test conversions, and then for a seal trainer with seals, he actually developed pulmonary tuberculosis from M. pinnipedia. So again, these are really occupational risk groups. This is long contact. You wouldn't worry about this necessarily with someone who's just going to the zoo. So in summary, zoonotic TB transmission can occur via foodborne respiratory cutaneous routes. Companion animals, so like dogs, cats, and birds, can become infected with TB, but it's thought to be rare, and it is of concern as a public health risk. Euthanasia is often performed in these cases, so just thinking about that with the average person who has a dog. M. bovis is a primary concern in cattle, but it is rare in the United States due to pasteurization, herd testing and culling, and slaughterhouse surveillance. Human to cattle transmission can occur. So if you have someone who's so I think the M. bovis causes like 1.4% of tuberculosis cases nationwide in the United States, whereas there are other countries where it's over 10%, like Mexico. So you might think about M. bovis with folks who are coming from other high incidence countries that don't have the kind of controls, especially on pasteurization. And also if you have a case who is having regular contact with livestock and cattle, there is a risk that they could transmit it to cattle. And then finally, zoo animals like elephants and seals can become infected with TB. Transmission with humans can occur, but is primarily of concern for individuals with close, prolonged contact. So like an occupational health risk. If you have a zookeeper who is working with elephants, I think it's 5% of Asian elephants in the United States have tuberculosis. So it is a risk. This was just a quick walk. So there are other species that can be infected with tuberculosis and have transmission with humans. Obviously monkeys, there are others as well. I just wanted to highlight a couple of them. So here are some references which are included.